A Blessing on Action by John O'Donoghue. And a little cheekily, I'm going to rename it A Blessing on Our Action Research. May the light of your soul guide you. May the light of your soul bless the work you do with the secret love and warmth of your heart. May you see in what you do the beauty of your own soul. May the sacredness of your work bring healing light and renewal to those who work with you and to those who see and receive your work. May your work never weary you. May it release within you well springs of refreshment, inspiration, and excitement. May you be present in what you do. May you never become lost in the bland absences. May the day never burden you. May dawn find you awake and alert, approaching your new day with dreams, possibilities, and promises. May evening find you gracious and fulfilled, and may you go into the night blessed, sheltered, and protected. May your soul calm, console, and renew you. Imagine if that's how we felt in our work. Thank you. And so I understand that each of us here is bringing our contribution, and my contribution is this school, this paradigm called action research. Some of you know, and some of you, I hope, will give it some thought. So mostly I'm going to speak through an example from Sweden, a little bit about principles, and then we'll end with an invitation to communities of practice, because this notion of with and relationship is, I think, the heart and soul of action research. We're trying to bring research with people into and taking more seriously relationship. Definition up there, you can see the relationship between theory and practice, the relationship between stakeholders and researchers. So that's really at the heart of the matter. And to be simple about it, the creating of a relational space. What is a relational space? It's a space where we can be real together and do what's important together. Relational space that can open us up to new ideas, conceptual space where we can truly share, and come into an experiment together, collaborative experiment, so that there's cycles, iterative cycles of action and inquiry together. So I don't come as somebody who's examining which is better, action research or conventional research. I come as an advocate, a champion. It's been many years that I've been doing this work, and I feel now that lots of handbooks and the journal is out there, I'm bringing my own particular flavor, which is really a deeper dive into those power dynamics that keep us stuck in our small inquiries, in those relational spaces that are often full of erotic feelings, full of power feelings, some of which is really weird and stuck. Well, I want to go there because I think that's exactly that. That's what opens up and frees us to truly be an inquiry together. Not all action researchers do that kind of weird stuff, but that's where my heart leads me. And action research fundamentally, I think, is about bringing our soulfulness, our heart, and our hands back into our work. To be an action researcher is really to have a change agenda. And we don't make any bones about that. So yes, it's an integration with objectivity of our deeper subjective concerns. A little way of understanding the contrast. The important point here is that there's no such thing really as a pure type. Many action researchers are also doing applied research. Almost all of us are trained as conventional researchers. And in my speaking today, and we have a book coming out tonight, it's, I think, trying to bring this more, bring the choir, if you will, into a larger choir. We have been, I think, a little bit too encapsulated in our own communities. But, you know, research that helps at this time of tremendous need feels like an important thing to do. We find ourselves embedded. We are part of life, and life has these problems called sustainability. We're embedded with that. We're not able to stand outside and look at that, although, of course, being external, taking that position as a choice is also important. It's not a method in the sense that do we do qualitative or quantitative? We use whatever method is necessary to get the work done. Many of us are indeed more qualitative, but not necessarily the case. And in the work that I'll describe now from Sweden, you'll see a lot of quantification because, of course, numbers are profoundly important. Measurement is profoundly important. So action researchers usually start from some question, some need, some problem. The loftier, the better, And so I know these guys partly because I'm professor at Chalmers, Jubilee professor at Chalmers, and my contact here inside of CHI is Svante Liefagren, a most marvelous physician who I think is really at the epicenter of what I'm about to describe. So the agency in groups working with is really what's at the heart of this story. So what's the need? Well, the need is, as in all the rich countries, healthcare costs are going through the roof because populations are living longer, and therefore chronic illness is just the de facto. Obesity, cancer, it's very, very costly. And so what are you going to do about it? Becomes a big question. So, there could be planned change. This is how it'll be. Often has so many unintended consequences. There's the chaotic, life will right itself. Same with climate change. Life will right itself. It's just, we'd like to be maybe part of it as human beings, right? So the action research orientation tends to be honoring the non-linearity, the complexity, in other words, but helping things happen. So coming back to this first person, this subjectivity, often as action researchers we say, let's put the key stakeholders at the center of the system and work with them to transform the system. Well, who is at the center of healthcare is, of course, the patient. So the patient pathway, understanding the patient pathway, making life better for patients, which is, of course, what healthcare wants to be about, but truly taking that seriously would and did become the focus of this particular work. So starting with the key stakeholders. The second person research is then coming into inquiry. In Sweden they call them learning platforms, but there has to be some kind of dialogic learning that's systematic in these inquiry and action cycles. That's the heart of action research, the second person piece that brings this information about the first person and brings it alive together. And then third person is this more conventional research, reflecting on that, bringing our numbers to it, telling that story in journals, but also, importantly for action researchers, creating conditions for social contagion. So telling about this particular experiment so that it can amplify through the system, or not, right? Because sometimes there's failures that are equally important to learn about. So as in any complex change endeavor, there's many, many entities, and don't worry about seeing everything. But essentially, this is what we're thinking about. With whom are we working? So patient is at the center. We know we're going to have learning platforms somewhere in there. And so let's have it be systematic in the sense that particular projects who are connected to hospitals could be one epicenter, and then we'll socially contage, if you will, out from there. So starting small is often, there's no particular recipe for action research, but these are some of the things that I've seen over the many decades come up over and over, starting small and getting big through social contagion. Understanding that for this to work, there have to be decision makers and people with some power who can bring ideas back into the system. So these are the kind of the circles that are working. So just one quick example of many, many experiments that are now happening inside this system is this one, learning with birth doulas in Northeast Gothenburg. So Gothenburg, which is where Chalmers is, has many, many immigrants. And many of those immigrants come, and they're going to be costly on the healthcare system, like all human beings are, because they're going to live long, and many of them are going to get cancer. It's sad for all of us. That's true for all of us. And the issue with the immigrant community is they were not used to cancer screenings. And in the area of reproductive health, maybe that was a little scary coming out of patriarchal culture. So what do we do? Again, how do we work with the patient? What's the patient's experience? Well, the patient's experience is they're not going to come to cancer screening, so therefore cancer screening must somehow come to them. It's very simple. So how would we do that? So inside the learning platform, which originated with healthcare workers, nurses, physicians, social workers, community, patients, the patients begin to say, well, what about if we were to work with people in the community that we know and trust? So birth doulas arise as a good idea. They're like midwives, if you will. And what if the midwives were put in charge of this project? So they would have good ideas for what to do. They could use social media. A lot of money is going to be saved here, so let's put some money into a mobile bus where you could do the cancer screenings literally on site. So more and more the patient is not having to go somewhere, but the somewhere is coming to the patient, okay? And one of the tricky, and then you make sure that this, you track it. Is it actually paying off? Are cancer screenings actually rising? And we already know that if cancer screenings happen, then down the road, cancer, especially things like cervical cancer, it's almost entirely curable if you catch it early. If you don't, it's very expensive down the road. So these kinds of interventions are fundamentally coming out of learning platforms where people are talking together. They're asking who's not in the room, who needs to be in the room. In this case, well, the doulas are not in the room. So how do we, make our platforms a little bit bigger? Then we come back every few months, we share what's going on, because somebody is being paid 25% of their salary to make sure that these learning platforms work and actually bring together the right people, the physicians, the clinicians, the social workers, and so on. So I'm hoping that that's making sense. So this thing of people sitting around tables, you see it everywhere in action research, and that's the flavor of it in this particular case in Sweden. All of this needs to get measured, and here's the overall measurements, not just from the doula piece, but basically the whole project is about how do we go to the patient as opposed to have the patient come here. And thankfully it's been cost neutral. Why? Because if you keep patients out of the hospital, you save an enormous amount of money. One emergency room visit is $1,000. So if you can avoid that, then you've saved quite a bit of money. So in my investigations, provoking Svante to write about this, and his is the leading chapter in the book that we released tonight. He went all the way back. He's himself a pulmonary physician, so lungs. He went back and remembered Lars in a conversation with Lars, and Lars was saying, oh my God, it's just dreadful. And Helga, Lars's wife, was saying, it's even more dreadful for me because when Lars is out of breath, I'm the one who freaks out. I'm the one who has to call the paramedics. And what do I know about medicine? So at the very moment where the patient is most in need and most scared and most stressed out, that's when they have to make these difficult decisions. And so it was in that conversation between Lars the patient and Svante the doctor, who was positioned to be a champion for change inside his hospital, inside his system. He said to himself, this has got to change. How do we have mobile units? Simple idea. How do we have mobile units come to the patient? How do we use these smartphones that are ubiquitous in Sweden? So it's like kind of basically like dial a nurse, so that the nurse comes to you. The payoff, it sounds expensive, but it's not, because the payoff is keeping people out of the emergency room. And then for the patient, they get to relax. You don't have to, worry quite so much. So, and then all the quantification that is behind that, what's working, what's not working, it's part of a quality control intervention inside this larger system. Svante, who was an MD, took a PhD in action research as he himself began to see the possibilities here. And because Sweden is a monarchy and it's in some ways a rather small country, turns out that the king heard about this project in the western region of Sweden, already pretty big. They were touching the lives of 100,000 people. But the king and then the Minister of Education Minister of Health heard about it and said, we want more of this. But the insistence was not to simply tell people in the other regions what to do, because who wants to be told what to do? Nobody. Instead, go out, if you would please, and share your learning platforms. Just have them in another county so that other people can hear your story, and maybe they'll work a little differently with some of their populations. So there's never a recipe, a to-do, but what there can be is inspirations, like, I think we could do something like that. So what's really going on here kind of amplifies a little bit what Lindsay was saying. New mindsets are being allowed create new results. So and I would like to say, and Svante I know would blush, Svante himself is one of those, leaders who's deeply aware, has an awareness practice, and is just, a kind of guy you want to hang out with. And so these are the kinds of people who bring around them teams, and agency then begins to amplify through the system. I work a lot with a guy called Bill Torbert, who has a theory of development, and this is a nice paper from a while ago in the Harvard Business Review, basically telling us that consciousness, which is really a function of awareness, is a really important thing for leaders. Unfortunately, we don't devote enough time to developing awareness and consciousness. It's not very hard. Silence is a big part of it. But we might even consider how to develop not just ourselves, but our communities consciously around awareness practices, because it is so important and because it's not that hard. Not that hard to do once we put our mind to it. I would suggest it's been made taboo in our scientific arena, as Johan was pointing to, in the past 300 years, that the self is kind of taboo because we've been supposedly external to the world. And I think action research is just trying to make a space for bringing the self back in, marrying the first person, pretty much like, it's all footnotes. It's all footnotes to Plato, as Whitehead said, right? Because Aristotle was Plato's student. I think this also, and I'm so thrilled to be a part of this conference where there's so many creative arts, storytelling, video, photo. That's one using theater that I've been using in this Eros Power work, because we can tell our story through our body, because it's actually the body who often holds a lot of the stress that keeps the system in place. But you don't have to use theater, of course. Simply sitting together and or working with folks you haven't worked with before, that way we're complementing conventional science. There's never a suggestion that action research is better than. It's simply that something huge has been missing. Let's bring the heart, let's bring the soul back in. Johan pointed, I think in politer terms than I do, to the problems of the past 300 years. And I would point to objectification, which shows up in our world. I use this rather provocative photograph, but objectification of the other, of nature. It all comes from this crazy idea that somehow we're external when we are life itself. Bizarre. How did they get us to drink that Kool-Aid? And therefore, action researchers are about engaging power structures. We do that in our work gently, or sometimes not, but I think gently is often better. We're bringing together this first person, which is the subjective, with the second person, which is the intersubjective, these learning platforms that I'm pointing to in Sweden as one example, and making that work available also as research and or social contagion practices. So I end here with an invitation to those of you who are touched by this but want to know a little bit more. There's many action researchers in the world, but I saw recently that we need to organize ourselves more as a global field, partly because I'm so influenced by my friend Steve Waddell here. He's like this meta systems guy. It's like, well, how do you organize the action research world? And so pulled together this network called Action Research Plus, where Plus is beyond the academy, beyond conventional knowledge. So I invite you to learn more about that. If you have a QR reader, you could just do it here. But literally tonight, because today is not busy enough for me, like let's bring out a book tonight, people. So there's an invitation from our community. This book is by donation. It's very important to us to get our information out in a way that's accessible. It's been too expensive, like literally. The price of action research books has just been crazy. So we've taken it into our own hands, like good activists, and we make this book available from our website by donation. But beyond that, we also have a number of co-laboratories, community laboratories for folks who want to work on issues of business and action research, or issues of relational action inquiry, like I do, or ones who are bringing mindfulness and creative practice into their work. That's all there, and we invite participation in that, simply so that we know that we are not alone. By working together, we know that we're not alone, and that's sometimes one of the most important things. So I thank you again.